Hi, I am Dr. Vineet Surena and I am consultant endocrinologist and diabetes at Manipal Hospitals Dwarka, New Delhi. And today I am going to discuss a little bit about role of air pollution in type 2 diabetes, which is becoming day by day very prevalent topic, especially in cities like Delhi and especially whole of the North India, where we are seeing this air pollution increasing during the winter time and leading to a lot of issues. So it's not only about the chest, even the air pollution, there is enough data nowadays to suggest that air pollution leads to increase in the diabetes incidence and prevalence both, and even the worsening of the existing diabetes. And this happens because of all this microparticles which has the PM less than 2.5 leads to increased oxidative stress and inflammation in our body, which ultimately causes increased stress on the pancreas, reduce insulin production, and as well as also it leads to increased insulin resistance, and finally leading to the onset of the diabetes in the patients who are living in such areas in a normal population. And also in the patients who are living in such area who are already with the diabetes, there also we are seeing the worsening of the diabetes control happening during this time because of the outdoor activities gone, food increases, and also it leads to increase in the weight, which ultimately leads to increase in the blood glucose, and as well as it also causes increased risk for the cardiac disease and the kidney disease. Also, the another issues which we see nowadays very commonly is the young onset diabetes, and that is something which has become really prevalent over the last 15 to 20 years. What we have seen is that earlier when I started my practice, the young onset diabetes was something which was happening at the age of 40 plus. Nowadays we are seeing the diabetes happening even in the persons who are at the age of 30 years, and even in the children who are at the age of 15, 12, 14. So youngest type 2 diabetes which I am seeing is 12 years of age, and all this is happening because of the poor lifestyle, poor nutrition, reduced activity, and as I talked about all this air pollution, endocrine disruptors which we are seeing, use of too much of the plastics, all this ultimately leads to increase in the prevalence of the diabetes. Also, if we talk about the pre-diabetes, that is also becoming very common even in the young people, and if I talk about the study which was done by the AIMS few years back, there they had shown that in the city like Delhi, there almost 50% of the population is either with the diabetes or with the pre-diabetes. And that is something which is very significant, and which is a kind of the call for the policymaker also that we have to act now. And rightly as said by our Prime Minister also, that we need to reduce the consumption of oils, leading to the reduction in the weight of the population overall and reduction in all these chronic diseases. And nowadays even we are seeing, so there is not much difference between the control between the type 1 diabetes and as well as the type 2 diabetes. If you look at the type 1 diabetes, which is mostly insulin dependent diabetes, and type 2 diabetes which is initially managed with the oral drugs, and then ultimately they also require insulin at some point of the time. And these also there is a very poor control, and this control is worsening over the years despite advancement in the medical field. And the reason behind that is, again we come back to the lifestyle which has worsened over the years, and despite having a very good drugs available nowadays to treat these kind of the patients, still we face a lot of challenges in bringing down their blood glucose. So thank you.